in the heart of Yorkshire.
Hello, emergency department.
An unbeatable team.
That way!
And stop, we're going to lay you down.
Hard at work 24 hours a day.
Does it count as your daily exercise?
7 days a week.
I can smell it now. It's a really bad burn.
Saving lives.
It might be that we need to put you to sleep in order to try and sort this out.
Helping loved ones.
It's a shocker, that.
Making the community they serve better.
We got you, lad.
You're being such a good boy.
A health service treating anyone.
Car door, house door.
Van door.
Big van door.
Yes.
So it's quite impressive, isn't it?
And everyone.
Oh, you're going to have a good black eye.
Are you a doctor?
A team doing anything and everything for each other.
It's just been mental down here. I will do it, I'll get to it.
We're strong people in Barnsley, you know.
This is Barnsley Casualty 24/7.
You're absolutely all diamonds. Brilliant.
We fixed him!
On shift tonight, Sister Jane,
Be very, very late in pulling bed.
Junior Dr. Josh Gemmell,
The cavalry have arrived.
Dr. Chris Yeoman,
Oh, just give you a second just to relax. Well done.
and staff nurse Amy.
I've got, what do they call it? Itchy bum or something? Not itchy. Itchy feet?
So, get ready to share a shift
What do you want? Whiskey. I wish, I'll join you.
with the team at Barnsley Casualty. Today's shift has only just begun, and Sister Jane is already playing catch-up.
There's no beds in the hospital this morning.
The waiting rooms are overflowing,
I've just had about 30 booking in the last hour.
and the emergency red phone is ringing off the hook.
What is a GCS at the moment?
When you are in charge of the shift, it's intense. Who's in 5? I cannot cope with that today. It's wham. You know, you start your shift and that's it. Oh!
And now, over in the hub,
Hello, Barnsley.
an emergency is being blue lighted in.
Seizure. Okay, what's his obs?
With resus already crowded, Nurse Amy is having to find space for one more.
I do get nervous when that red phone goes.
You take him straight to Reese's, please.
It's very on your toes, demanding.
A 52-year-old warehouse worker has been brought in by paramedics.
Wojciech, you okay, buddy? You okay?
Wojciech's concerned colleagues dialed 999 after he started fitting at work.
Wojciech, you okay? How are we doing?
Hello, darling. My name's Amy. I'm one of the nurses looking after you. All right, sweet?
We got you, lad.
All ready?
On slide. Ready, steady, slide. Here we go.
I told you we'd do it.
Can we go up as well? Yeah, please.
Nobody wants to be a patient in resus. Nobody wants all the monitoring attached to them. Nobody wants to know that they're that unwell.
Paramedics hand over to Dr. Jake Winterbottom.
He's been at work today and has been found by his colleagues to be on the floor, blood coming out of his mouth. But he's starting to come round and has spoken to us and said that he's a known epileptic. Whilst en route, literally about 2 minutes out, he's had another fit. Thank you very much.
Wojciech appears to have come round from his latest seizure.
Do you know why you're here? Do you know what's happened? Have you had a fit? Yeah. Do you suffer with epilepsy? Okay.
So, Dr. Winterbottom can now make his own assessment.
Do you know where you are at the minute? Hospital. Do you know which one? Barnsley. Okay. What time did you have your first seizure?
What time?
Yeah, can you remember?
But Wojciech is drifting in and out of consciousness.
Wojciech.
If the recovery time between seizures is too short, he could suffer permanent brain damage. Back in the hub, the emergency red phone has rung again.
Is there me walk-ins. Do you want to grab an ambulance with Becky then? Because I've got 5 ambulances.
Another patient is headed for resus. 64-year-old carer Lynn has been suffering from severe abdominal pains.
Lynn, you're not allergic to anything, are you?
No.
Dr. Chris Yeoman is assessing her, and daughter Louise is by her side.
I'm going to give you some antibiotics as well, okay?
Yeah, thank you.
You said you were well over the weekend, and yesterday morning about 7 o'clock started with the diarrhoea.
Yeah.
And about 3-4 hours later had the sudden onset tummy pain, 10 out of 10, severe sharp pain down on that right lower side. And then the vomiting started today as well. Just remind me what time that was.
That was at 4 o'clock when I woke up sweating.
Do you need any pain relief? Did the paramedics give you some?
I don't think
I thought they had, sorry, yeah. We'll sort you out with some then, okay?
Dr. Yeoman is concerned, so calls the on-duty surgical consultant.
So she's usually relatively fit well. She presents yesterday morning, developed a bit of diarrhoea, and then about 3-4 hours later, sudden onset, right lower quadrant pain, kind of maximal 10 out of 10, and then ended up coming in here today. She's very, very tender in that right lower quadrant.
The consultant is so concerned,
Thank you for coming down.
he immediately conducts his own assessment.
When I touch here, does it hurt?
Yeah.
It hurts me.
Yeah.
Can you lift this leg for straight? When you do that, does it hurt?
Catches me there.
Okay, that's fine. Can you give me a big cough? Yeah. When you do that, does it hurt?
Yeah. Yeah.
Lynn is in too much pain for this to be a simple infection.
It would be wise to do a CT scan.
Yeah, that's all kind of thought, yeah.
The doctors suspect she may have ruptured her appendix.
The surgical doctors want to do a CT scan to have a look at your tummy, see what's going on.
Jesus. I just thought it was going to be an infection. Sorry.
No, that's fine. Why are you saying sorry?
I can't be poorly. Can't be out.
Everyone's allowed to be poorly. You're in the right place just to look after you.
Lynn is a full-time carer for her husband. If her appendix has burst, she'll need emergency surgery. In Barnsley Casualty today, Sister Jane is struggling.
Has that patient from cubicle 7 gone? Where's me yellow staff?
There's a shortage of beds on the ward and her department is feeling the brunt.
Hospitals are just full to capacity all over the country, and it's hard for the A&E departments. We don't have the facilities really to bed patients down. We're not a ward, we're completely different to a ward.
And with the emergency red phone ringing with more patients to treat, she calls an emergency meeting.
It's got quite busy, as it always does at this time. I am trying to get nurses off for the lunch so that they can swap over. There's a couple of ambulances due in. We have good days, we have bad days. But I think everybody will enjoy a little bit of adrenaline. Lovely, thank you.
In resus, full-time carer Lynn and her daughter Louise are waiting to discover whether she might need an emergency appendectomy. Dr. Yeoman has the results of the CT scan.
Hi, Lynn. How are you getting on?
Yeah, I've had my scan.
Yeah, you've sat up now?
Yeah, my blood pressure's come up a little bit.
Yeah, you still feeling dizzy, or are you feeling a bit better from that?
Just a bit lightheaded.
Do you want us to lie you back down?
Yeah, can I?
Yeah, of course I can.
Just a little bit.
Just tell us when.
Yeah. Oh, that's fine.
Out there?
Yeah, thank you.
Okay. So your scan's been reported. It shows you've got appendicitis.
Oh, right.
Yeah.
Oh, bloody no.
Yeah, probably need an operation for it.
Oh. It's a shocker, that. How do you get appendicitis when you're 63? I can't be poorly. I'll be fine. Get you up to ward and get you sorted. I wasn't expecting that. I thought it would have just a infection. Yeah. I knew it was too bad. Pain was too bad.
Dr. Yeoman can now prepare Lynn for surgery.
So I've had a chat with the surgical doctors,
Yeah.
okay, the same one who came and had a chat with you earlier. Yeah. We're going to get you up to their ward,
Yeah.
and then they'll explain things from then on, okay?
Oh God, low. Well, at least we know now.
Yeah, at least sometimes that's part of it, isn't it? And needing to know what it is.
But with no beds available upon the ward, she's having to stay put for now. Also in resus, Wojciech has come round from his latest seizure. Nurse Amy needs to check for any injuries it may have caused.
Is it your tongue that you've bit? Let me have a look. Oh, you've got a lovely bloody tongue. Apart from that, have you got any pain anywhere?
No.
No? Biting your tongue is quite common, especially when you're seizing, because you've got no control and your jaw just clamps. He did take a nasty chunk out of his tongue. Were you at work?
Yes.
Can you remember it happening?
No.
No, you just hit the deck.
Wojciech may appear to be fine.
I'm just going to jot all your vitals in here. It's just your blood pressure and stuff, that's all.
But it's the number of seizures in a short space of time that is of concern.
You know when you have these episodes of having your seizures, how many do you have normally? So you've had 3 today?
Yeah, a few.
A few?
Yeah, within, I don't know how long time, can't remember.
Okay, that's fine. If he goes home and he's on his own, the risk of him having another seizure on his own can cause more problems if there's nobody there to help him. Thank you. 36.3.
For Wojciech, the next few hours will be critical. In the hub,
I need somebody to do walk-ins because 30's booked in. Is that all right?
today's bed shortage on the wards means Sister Jane is having to readjust her nursing plans.
Ellie, are you on walk-ins, love? No, I've got 3 nurses on ambulances and no one on walk-ins, and there's about 30. If you're sailing through that storm, then it's bad. It is bad. Hi, it's Jane. Yeah, you did. I've got to do it. It's just been mental down here. I will do it. I'll get to it. Just bear with me.
Triaging all the walk-in patients is staff nurse Mimi.
Elliot, please.
22-year-old Elliot has been involved in a car accident.
So, tell me what's been going on.
I went to A&E in Birmingham where the accident happened.
And when was this?
This probably around 8 o'clock in the morning that I was at Birmingham.
Today?
Yesterday.
Yesterday?
Yeah.
I could tell, you know, behind that hard macho exterior that he was presenting with, that he was hurting, he was in pain.
I went to McDonald's because my phone needed charging. I waited for my mum to arrive. 3 lads came over to me. One of them took my phone and then followed him out. Definitely punched in the head multiple times, hit on the jaw a couple of times. I was kicking the chest.
There are definitely times when I have to stop.
Okay.
And take that deep breath and just check in with my emotions.
Okay. And these injuries, are they from the car accident or from the assault?
So the black eye, everything like that, the scrapes there, none of that was the accident, only this scrape here.
Okay.
My son has been through a physical assault, quite a bad one, and them emotions kind of boiled over because I could completely understand the dad's anger, the upset, the frustration.
Any loss of vision?
No loss of vision. I believe I may have lost consciousness at some point. I also threw up about 20 minutes after the assault while giving the statement to the police.
If you've lived that situation and you've sat in A&E with your child after they've been assaulted, and then you're then responsible for another patient with his family, it's hard not to get them emotions crossed, and sometimes it can be quite challenging.
Elliot's mum and dad wanted him to go straight to A&E when it happened, but he refused.
He's quite stubborn, so we haven't allowed to get him to come here.
Does anyone want to come to A&E? Let me ask you that, honestly.
Nobody
Do you
ever
want to come to A&E?
Well, I work here, so...
Exactly, and you still don't want to come.
I don't have a choice. But
No.
I know what you mean.
But no, I don't think anyone wants to go to a hospital.
You need courage. You need a lot of courage and emotional intelligence to be a nurse. It can be very draining, emotionally and physically.
The injuries on Elliot's face look nasty, but Nurse Mimi is concerned that there might also be internal damage. She orders an urgent X-ray.
I just need to get the name nursing on because lead nurses are not too happy with me.
There's no let-up in the hub for Sister Jane.
I've had enough.
The patients keep on coming.
Thomas, do you want to come through for me?
And it's not just the adult waiting rooms that are packed.
Nice to meet you. My name's Josh. I'm one of the A&E doctors.
Paediatrics are jammed too. 15-year-old Thomas has had an accident.
It's your finger that you've done, is it?
Yeah.
There you go. Pop yourself in there for me.
Dr. Josh Gemmell manages to find a free cubicle.
Do you want to just tell me a little bit about what you've been up to with that?
Well, one of my mates had phoned my other mates, phone over a fence, and I've tried climbing in to get it, and my ring's got caught on metal bar. I can't move my ring, otherwise it starts hurting again.
Yeah. Can you bend your finger at all for me?
A bit, yeah, otherwise but it hurts.
A&E, accident and emergency. Lots of people here, you'll find, will call it anything and everything. And that's because really anything and everything can and does turn up. Bend it at that joint for me there. Yeah, and straighten it all the way back out again. Have you got any pain to this area here?
No.
You've sliced it quite nicely, haven't you, there?
Yeah, it's my ring that's done that.
How attached are you to these rings?
Not that very attached.
As that finger swells up, that ring effectively is starting to clamp that blood supply off. And in extreme circumstances, if it swells up enough, you get enough clamping that you're going to start to cause permanent damage. I think that does need to come off, really, because otherwise that swelling is going to potentially cut your blood supply. So, bear with me 2 minutes. Let's go and see if we've got... I haven't actually had to cut a ring off since starting here, but most A&E departments will have a specific little ring cutter. Yeah. OK, I'll be back in 2 secs.
It's not just Dr. Gemmell who's flummoxed. It's a first for Nurse Liv too.
I don't know what I need, which doesn't help me. I've not seen a ring cutter before, so it'll be exciting to see.
But she's going to have to wait while they get the extra strong cutting equipment that they need.
Yeah.
Over in the hub, Sister Jane faces all sorts of challenges.
Does it matter? What has it got to do with you when my son's going?
Just tell him to be quiet.
In cubicle 3, she's got a patient kicking off.
Screaming and shouting and causing a scene. It's not something that you want, you know. People don't get better in environments like that.
Because it's not happening, eh? Nobody will take my son.
At the end of the day, there are other patients in that department that need to be kept safe.
In resus, Lynn's been told she needs an urgent operation to remove her appendix. Daughter Louise is breaking the bad news to her dad.
At least we know what it is now. She's a bit upset. So, good, I thought. I didn't think you were gonna. It shocked me a little bit. Are you okay? Yeah. All right then, I'll speak to you soon. Bye, Dad.
My daughter's waiting for an operation. My husband's not well. So I'm one that does everything and runs about after them all.
I was shouting at you on Monday because I thought you were hungover. I didn't realise. That you'd got appendicitis.
That's not to do with going out.
I'm not saying it is, I'm just saying.
I just thought it was a hangover. I thought, oh, I've done it again, too much. But then with pain, and I thought, oh, that's not an hangover with pain, is it?
Lynn underwent emergency surgery,
Do you want to move this lady into 6?
where they discovered her appendix had already burst. She's now recovering well. Back in resus, paramedics have brought in 54-year-old Glyn, who has suffered a dislocated hip for the 11th time.
Have you done it?
I've done it. It's under the bed. Right low down.
Glyn will need to be anaesthetised, so the team can try to pop his hip back into its socket.
Is it an artificial hip? Yeah. You want to take your jacket off, make you get in a little bit more comfortable.
Still in resus, Dr. Yeoman now has a new patient to treat.
We'll have to pop a cannula in so we can give you the medicines through it, okay? So we're going to give you some sleepy stuff, okay?
Hip dislocations can sometimes be a little bit tricky to put back into place. If we can get a joint back into place within the department, there is a chance that they might be able to get home that same day. Then I think that's probably the preferred option for most patients.
All right, sharp scratch. Couple of big breaths in. Big breath in. And out. It's a bit sore sometimes when it goes in. I'm sorry if it is. All right. 90 out. 1337.
It's not something that we see perhaps quite as often as shoulder dislocations, so I think the scope to practice it and to learn is probably slightly less.
How you doing, Glenn? Glenn? Chris, do you want to have a go or do you want me to have a go and you do this?
I'll take over it, right, yeah. Go for it,
If Dr. Yeoman can't get the hip back in, Glyn might require emergency surgery.
All right, bud.
In Barnsley Casualty, Sister Jane is dealing with an angry patient.
All we want to do is just try and calm it down and, you know, either get the patient away from other patients so that he can deal with what he needs to deal with before he gets his treatment. No, he's just gone for a cigarette with his girlfriend, yeah. She's rolled him a cigarette and I said he can't smoke in here. She went, I'm just going to take him out, calm him down and then I'll bring him back in.
Over in Resus, Dr. Yeoman is trying to manipulate Glyn's hip back into its socket.
All right, we'll give you a little bit more.
All right, then, well done, well done. All right, just give you a second just to relax, well done.
This is the 11th time it's happened to Glyn.
We sometimes see that once a hip or a shoulder, for example, has been dislocated, a patient is more prone to this happening to them again, and unfortunately can enter into kind of a cycle where even smaller instance or smaller trauma will cause it to dislocate again and need to come into hospital once more.
I think we're good.
Yeah.
From personal experience, I've found that for patients for whom it has happened multiple times, their joints are sometimes a little bit easier to get back into joint.
Yep. That's it.
Well done, Glenn. Glenn! He's waking up.
Fine, buddy.
I'm just going to let you come round. No, just stay there. You're okay.
Dr. Yeoman is confident the hip is now back in place, but will need an X-ray to confirm.
You did well there, Glenn. Well done. I can't quite make you out at the moment, Glenn. We'll let you wake up a little bit more, all right? No, get your leg down. Don't you lift that back up.
If he moves too soon, too quickly, there is a risk the hip could pop out again.
What we don't want you to do is start bending that leg again and then it pops back out. Let's have your X-ray first, then we'll go from there. All right?
Any further complications, and Glyn will require emergency surgery.
You don't like resting?
No.
In the hub,
Andy, are you free? Resus up to AMU, love, and then I've got Resus to CT when you come back.
Sister Jane is having to move patients all over the department because today there are no free beds on the wards.
Lack of beds is a big thing when we're physically full at capacity, and you know, you have a 2-hour handover wait for ambulances and there's nowhere to put a patient and you can't see a patient that's coming in through the door because there physically is no room, then that's unmanageable.
But lack of beds is not the only problem that needs solving today. Over in paediatrics, 15-year-old Thomas's ring is stuck on his injured finger, causing it to swell.
I'm feeling terrible at this moment in time.
You pop yourself down on that chair for me.
Dr. Gemmell needs to get the ring off before it causes any permanent damage.
So basically, it's just a little saw, and this is going to go between your finger and the ring. Okay, so we're just going to hook that bit under the ring there, and then we can try and saw down. You're doing really well. How's that feeling under there? Is that okay? We'll be really, really slow. Okay. Let me know if the ring's getting too warm for you as well. Sorry, mate. Can you just relax down again for me?
No, it's just sliding it.
Sometimes it can take quite a while, okay, because rings are quite often made of quite hard substances. often when we have to cut the rings off, it's often in older people who have rings, their wedding rings, their family heirlooms, their beautiful pieces of nice 24-karat gold jewellery, which is nice and soft, and we can go through like a hot knife through butter with our cutting equipment. But we're not quite sure what his ring is made of. He thinks maybe a bit of titanium.
Not going through whatsoever.
We're not making much progress, are we?
No.
Go and see if there is another one. Just, I mean, not that there really looks to be anything wrong with this one, but they're just, sometimes they do get a little bit blunted. And it looks quite tough, that ring, as well. Sorry, mate, I know it's quite sore, isn't it?
Emergency nurse practitioner David has been called with some new tools.
Oh, is that the new blade?
That's a brand new one.
Let's give that a whirl, then.
No, it's just doing the exact same as it would have been.
We've currently gone through 3 or 4 of our little handheld circular saws and not really made much of a dent. Right, any more ideas?
You could try a nerve blocking finger.
What's that?
An injection to numb it.
Just local anaesthetic, mate.
That way you can't feel the finger, and then we can actually try and remove the ring with a bit more force.
Is there any other way apart from anaesthetic to get it off?
I just don't think we'll get it off over there at the minute. It's a tough cookie, isn't it?
With the tools not working, a different approach is called for.
As horrible as it seems, you just need to pop your hand into this beaker of cold water and I'll bring you some more pain relief through, all right?
It's hoped the cold water will reduce the swelling.
It's not what you need, is it, really? It looks very, very sore.
Especially not when you pee.
Especially not when you... Still got your sense of humour, anyway.
Yeah.
The longer it takes to get the ring off, the greater the risk of damage to Thomas's finger. All the team can do now is wait. With resus full, Dr. Winterbottom is hoping Wojciech is now stable enough to go home and a bed can be freed up.
Can you remember what happened earlier now then?
I just can remember I woke up on the floor.
Yeah.
That's
it.
Now.
Yeah. So is this similar to normal seizures?
Yes.
Yeah, okay. And how are you feeling now? Back to normal?
Yes, definitely.
Yeah. We can either send you home and you can go home if you feel up to it, or we can keep you on the medical ward overnight just for a period of observation.
I want to go home.
You want to go home?
Yes.
Yeah, okay.
Everybody wants the same outcome, but first Dr. Winterbottom needs one final check.
Who's at home with you?
Nobody.
No one. Anyone to keep an eye on you over the weekend at all? Any family nearby? No. Okay. Bear with me.
The risk of Wojciech having another fit at home and going undiscovered is still too high.
There's nothing better, just my own sofa.
It's not yet safe for him to leave resus.
Hey up, Carly, it's only Jane down in A&E, love. I need another male surgical bed for a gentleman who was discharged 10 days ago and he's returned.
In the hub, there's been no let-up for the team since they clocked on this morning.
He's going to need to come in, he's in a lot of pain, he's needing morphine for his pain. All right, lovely, cheers, bye.
It's making Sister Jane's task of ensuring everyone gets a lunch break challenging.
Right, so Ellie, my Dun's gone for his lunch, love. Lauren's going for hers. I personally like to make sure that everybody else has had the breaks before I have. Emma can go.
It's been such a tough shift that Sister Jane is having to break one of her golden rules.
I never go in the sweet drawer. You see, if you have a jelly worm or two, they're not fattening. Are they not? No. Because they're clear. You can see through them.
What I need you to do is I need you to shuffle up.
In radiology, 22-year-old Elliot is having an X-ray after being assaulted by a gang. They're checking for signs of internal bleeding or fractures to Elliot's face.
Round to A&E, they'll have a look at the pictures for you.
Perfect.
Let you know what's going on.
With Elliot's complicated case history, Nurse Mimi needs to bring consultant Dr. Greer up to speed.
He went to Birmingham. He's had a CT. That was fine.
Hi Ellie, nice to meet you. That's your x-rays there. Okay, so the bit we were focusing on is around your right eye, where the bruising is, and there's no fracture there. It looks absolutely fine.
There are more and more assaults on young people coming through.
It's likely that you've got a bit of bruising, which will settle after a few days. Simple pain relief, paracetamol, ibuprofen, should do the job. Perfect.
It's a big thing to be attacked like that. It can have a roll-on effect with your mental health as well as your physical health.
Anything you want to ask me?
There's going to be no scarring. It's just a whole tissue damage. Perfect. No, that's everything I could ask for. Thank you very much.
Great.
By offering that support, you're going to be helping this not having a roll-on effect in their life, or this coming back to haunt them in a way.
Stay safe, all right?
You too.
Even on your worst days, it can get worse.
So good job of you, tough lad. Good. I'm glad it got sorted.
6 weeks on, and Elliot is still feeling the after effects of his attack and is under the care of his GP.
Chloe, do you want to go for lunch or Levy?
In the hub, the lack of beds today has led to a lack of lunch break for the nurses.
So Mimi's gone for break and I've sent Ellie. I've sent Ellie gone for break as well.
And it's not just the patients Sister Jane needs to look out for.
You know, you look at the nurses that you've got around you and they're running around with a million things going through their head for their 20 or 30 patients that they may have to look after. Have you seen Aidan, anybody? He's what? He's gone for his break. Oh, aren't they good? They just go themselves.
Hello, is it Glyn? Yeah. Shall we take you in for X-ray?
Yeah. Over in radiology, Glyn's dislocated hip has been manipulated back into place. But that might not be the only injury he's suffered.
Does it feel less painful now?
Yeah.
Yeah? Yeah, I can see your legs looking a bit better.
When a patient with a hip dislocation comes into A&E, we have to be sure there's no other signs of trauma or injury that may have occurred during whatever incident it was that caused it to dislocate. We'll always send for a hip x-ray, so hip and pelvic x-ray, to make sure there's no other fractures about.
Need to bend up this right leg so it's out of the way. There we go. That's it, perfect.
Back in the hub, Dr. Yeoman can study the results.
So you can see on the first one here that the prosthesis, so the ball part of the hip joint, isn't sat in the socket, and that's what we're trying to put back. And after the procedure, after you had a bit of sedation and manipulation of that joint, you can see it's back in place. And you can see that quite well on the second view as well. So you can see it's all kind of nicely in line, back where it should be. I'm just having a chat with the orthopaedic doctor to get you a bit of follow-up, because it's no good you having to come in so often with it in and out like it is, okay? As soon as you're up and about and you've had something to eat and drink like you have, I'll be happy for you to go after that.
Yeah. Before Glyn can be discharged, he's going to have to show that he can stand and walk.
Okay? All right, any questions? No. All right, nice one.
No, come on. Glyn might have come through the ambulance doors on his back, but he's now able to walk out through the front door unaided.
Well, you're walking all right now.
Glyn had his follow-up with orthopaedics and is hopeful there won't be a 12th visit to A&E. In paediatrics, the cold water has not eased the pressure on 15-year-old Thomas's swollen finger.
Here's the offending finger. I think that's looking okay.
If they can't relieve the swelling, Thomas is in danger of losing it.
Just potentially whether that's just a little bit of a step in the cortex there.
But Dr. Gemmell doesn't want to do anything that might damage the bone.
The cortex of the bone is essentially the edge of the bone, and we're looking for any evidence that we've got breaks in the edge of the bone.
He comes up with a fourth approach.
Have you got a paper clip on you? That'll probably do it, to be fair.
But first, Dr. Angus Colehart thinks he has a solution.
Is that all right? You're okay?
Yeah. There's no pressure to kind of bear through this, okay? If it's too painful, we'll stop. All right?
There can be a little bit of a competitive element to these problems, and often we'll all like to have a little bit of a look, all like to have a little bit of a go and see if we can be the one to solve it.
I don't think this is working.
No, it's not.
Obviously, Angus tried, he thought he saw an opportunity, but no dice. He's failed miserably, as I have.
It's been 3 hours, and Dr. Gemmell is running out of options.
Hi, could I speak to theatres, please?
He knows the ring needs to come off quickly.
Thank you. It's becoming like a personal challenge, this.
He calls the surgery department to see if they have any tricks of the trade.
We've got a kid down here who's got a ring stuck in his finger and an injury distal to the ring. His finger's swelling up quite a lot. We've already kind of gone through a couple of ring cutter blades trying to get it off and tried another few things and nothing's worked. I don't know if you guys have anything sort of slightly more industrial that might be able to cut through a ring. Yeah, we've tried that. That's not no dice. Bro, cheers, mate. Bye now.
Nothing.
These things are the reasons that I really love A&E. There are lots of these little problems which need to be solved, and not all of them are immediately obvious from a strictly medical perspective how to best go about it.
There's just one option left, one Dr. Gemmell was hoping to avoid.
I guess we'll speak to the fire brigade. You're going to be excited about that. I'll go and let him know. I think this is my third ring I've had to call the fire brigade to come and take off. And it's always a slightly embarrassing moment because these very large, burly, well-built firemen turn up in their tight-fitting T-shirts to save the day. Right, it looks like it's going to be a chat to the fire department, mate. We'll see what they say. Obviously, hopefully, once we've got it removed and got it off, that's about the end of it for you. We can let you home. How's your hallelujah?
But if the firefighters are busy tackling other emergencies, there's no guarantee they'll arrive in time to save Thomas's finger. Sister Jane and the team have had to cope with patients constantly coming in to Barnsley Casualty today.
Hi, it's Jane. Why can't you take him back? He is for discharge. He's medically fit for discharge.
But there's no beds in the hospital to move them out.
What's your number? Just because... Yeah. OK. Right, if you can let us know as soon as possible, because I just think they won't admit him because there's no beds either. All right. All right, love. Cheers. Bye.
Sister Jane has finally managed to get her nurses off for their break.
Have the back's rounds done? Oh, I love you, Aidan.
And now it's her turn.
Phone's there. Everybody's had the dinner. CDU have had the dinner. So there's nothing else to do. Nobody wants to go for the lunch at 20 to 4 when they've been in work since 7 o'clock.
Go and enjoy your food, and it's a little bit late for lunch, isn't it?
Not to worry. It's one of them things, innit? It's just the sheer grit and determination that will get them through the shift. I'll see you later. See you later, Mel. Enjoy.
Over in paediatrics, Dr. Gemmell has tried 4 different approaches to save Thomas's swollen finger. His 5th was a call to colleagues in another emergency service.
This looks very fancy.
Yes, it is. We've got diamond cutting blades as well.
Here we go. The cavalry have arrived. The last thing you want in this situation is for someone to turn up and instantly fix the problem you've been trying to figure out for the last 2 hours.
But Dr. Gemmell is happy to swap professional pride to make sure the finger gets saved.
That's quite warm, that.
Yeah.
Sorry.
It's all right.
That's still not through, huh?
No, not yet.
I don't know where he got this ring from, but whatever it is, you know, he should be marketing it and selling it. It's clearly a toughest substance known to man.
Even the firefighting equipment has taken nearly an hour to cut through the ring.
True.
That looked like it went.
Hang on, might be.
Yeah. Yes.
Yep.
Get in.
All right.
Thank you.
Morris.
I was quite relieved to see that even with their mechanised cutters and fancy diamond-tipped saw teeth, that it still took them about an hour to get this ring off.
Thank you very much. See you later.
That makes me feel a little bit better about my pathetic efforts. Okay. So the main thing is that it's off, and you can keep that forever as a little souvenir now. All right.
With the ring gone, Dr. Gemmell can now treat the finger itself.
Right down at the bottom of this middle one, there is something which very possibly looks like just a little chip of the bone has come off.
Yeah.
Okay, so we're just going to give this a little bit of a clean, get a dressing over the top of that, and then just strap your fingers up one to the other, and then you can finally get yourself home, okay? There are lots of times that things can be really frustrating, but if at the end of the day the patient's happy, the family's happy, you're happy, you've fixed the problem, then that's trumps everything for me.
That probably really hurt, all right.
Yeah.
It's the other problem, we're wearing gloves on it.
Yeah.
Thomas was referred to the fracture clinic, and the finger is now causing him a lot less drama than it did today. Over in the hub, Sister Jane is feeling all the better for having finally had her lunch.
Ah, Asim!
Hello.
How are you?
Oh, very
Have you
good.
got cold?
I'll put it full now.
Oh, I thought you were snuffling.
While she looks out for her team, it's important to have someone else looking out for her.
It's nice to know that you've got those sort of consultants with you when you're in charge of the department. It's a great camaraderie that we have. What, love? Behind there. Behind it.
Okay.
Oh my goodness gracious. Look at that. We are a great team. We are a family.
Are you looking for me? Or in HTC?
Yeah. I was looking for you, but I'm not now.
Over in Resus, Nurse Amy can finally deliver some good news to Wojciech.
Yay! You're going home, my love.
Doctors are confident his current episode of seizures has come to an end, but so too has Nurse Amy's shift. She won't be around to discharge Wojciech herself.
Came in here, but we're feeling good. It looks a lot better. Looks a lot more perky. So it's just
You
cannula
feeling
out and
good?
then home.
Yeah, it's
You happy?
Oh, yeah.
Is that all right?
Yeah, that's absolutely fine, yeah.
It's quite a disappointing feeling handing over a patient. You feel like you've done a lot for the patient and you want to see them at the end of the journey. Do you want me to take his cannula out on that before I go?
No, you get off. Yeah, go.
Do you know that whoever you're handing over to, whichever nurse it may be, that everything's going to get done for them still at the same standard that you provided their initial care with?
Is that still something?
You can take them off in the shower, he'll be so.
Oh, yeah, that would be a better way to get it up. All right,
You got everything?
Yes, I
Come on then, let's show you the way out.
Thank you.
Wojciech is now back under the care of the community epilepsy team.
All right, thank you.
You take care of
Have a
yourself.
nice shoot.
Also heading home is Sister Jane, but not before she checks in on one final patient.
You can. What do you want?
Whiskey.
I wish. I'll join you. What do you want to drink other than whiskey?
Just coffee or tea, please.
Let me get you a coffee. It's not an easy job. It's not for the faint-hearted because it is long hours and it is hard work.
Well, it's been a pleasant day, not the gruel of that shift, hasn't it?
Sister Jane's bed-battling shift has finally come to a close.
There is nothing worse than starting your shift like that. In effect, you are a ward as well as an A&E department and you don't know which way to turn for the best and your head is buzzing.
But as the new shift arrives, she can go home knowing she's done a good thing for the community she serves and the colleagues she serves with.
It's always better to hand over a department that's better than what you've been through for your shift. Yeah, it is a great sense of achievement and you do feel like you've done a good job and you've left it better for them.